What if I told you pain isn't as scary as you think? You stub your toe, ouch, you feel pain. You slip on ice and you tear your ACL, ouch, major pain. You stand up from sitting at your desk all day and you throw your back out, more pain. But does pain always have to feel the same if you stub your toe, tear an ACL, or throw your back out? Of course not. But our life experiences and exposure to pain and struggle may influence how we react to how much pain we feel. In fact, how you feel pain is influenced by your genetic makeup, your emotions, personality, and lifestyle. If you've been in pain for a while, your brain may have rewired itself to perceive pain signals even when you're not in pain. But what we can learn to do is how to undo this and override our internal systems and take back control. Welcome to Better Mobility, Better Life, where you can learn how to break mental and physical barriers to getting healthy and functional, where you can learn to become a better athlete, live pain-free, and how to age with grace using physical therapy techniques. Hey friends, I'm Dr. Linz, a licensed doctor of physical therapy with over 15 years helping people from all different backgrounds get back to their fully functional selves. And today I want to talk about 6 techniques that you can do to learn how to override your internal pain signals. If you're new to the channel and you want to learn more about increasing your mobility, regaining functionality, and living pain-free and overall a better life, please subscribe. Have you ever heard of athletes playing through major injuries like a broken bone or a torn ligament? In 2008, for example, Tiger Woods won the US Open with 2 stress fractures in his tibia, and his knee required reconstructive surgery right after. In 1996, gymnast Kerri Strug vaulted on a broken ankle to clinch the gold medal for the Team USA in the Olympics. Kobe Bryant, aka Black Mamba, one of the greatest basketball players of all time, played through multiple injuries including broken wrists, ankle sprains, Achilles tears, and a hurt back. Now these are all examples of professional athletes pushing themselves beyond their limits in order to achieve something great. But their mental toughness and control of their pain is something that we can all learn from. Let's talk about 6 techniques that can help override our pain signals. The first one I want to talk about is deep breathing, and this will activate the parasympathetic nervous system, reducing the body's stress response. Deep breathing at its core is the best of all relaxation techniques, and it's the first skill we should master. So you're going to start by taking a slow, deep breath, holding it for a few seconds, and then exhaling. So let's do that together. So you're going to breathe in, and then hold it for a few seconds, and then I want you to breathe out. And it's best if you breathe in through the nose and then out through the mouth. To help stay focused, you can pair your breath with a word or a phrase, like inhaling the word calm and exhaling the word stress. There are also various apps available for smartphones and tablets that use sound and visuals to help support your breathing rhythm. Some common apps are Calm and Insight Timer. I personally like using Insight Timer and choosing a track which promotes positive vibration and manifest abundance. You can also just search YouTube for relaxing music. It's amazing how once you slow your breath and focus on relaxing, you find out how tense you were. Oftentimes, I'll do breath work or meditate for 5 minutes only to realize that I've been short of breath and my mind's been going a mile a minute. And I don't even realize how stressed out I am. As a society, we've often normalized stress and we feel like we're running around with our heads cut off. This is a lot of times when ailments or old injuries, maybe some lingering pain can start to creep up on us. And a lot of times once we slow down, often at night, we'll start to feel that pain come back. So take a breath, slow down. You have more control than you think over your body and how it responds to your daily activities. All right, so the second technique that we're going to do is to learn how to elicit a relaxation response. Triggering the relaxation response acts as a counter to the stress response, which often increases the heart rate and puts the body at high alert. So we want to counterbalance that with the relaxation response. The best way to do this is to lie down, but you could do it in a seated position as well. Get nice and comfortable. And you're going to close your eyes, and what I want you to do is just contract all your muscles for for a second or two and then relax. Focus on all those muscles relaxing, and I want you to just try to think about nothing. So ideally, sitting here for 10 or 20 minutes is good. If you feel that your mind is starting to wander off and think about all your daily activities, just say a simple word, refresh, and then come back to how your body is feeling. So you can do this first thing when you wake up or before you go to bed. Those are good times when you start to slow down and really try to relax as much as you can. All right, so the next technique that you can try is guided imagery or visualization. And why does this work? It works because it alters the brain's perception of pain by creating a calm mental scenario. For example, I live down here on the island of St. Croix in the US Virgin Islands, and a lot of my patients get pain relief from going to the ocean. So visualize yourself getting into the ocean, floating around, getting into a position where, weight is no longer pushing down through that back. All these things can help. If you're near a forest, vision yourself going through the forest, walking through the forest and taking away that knee pain. You're pain-free, you're moving freely. All these things can trick that brain perception and decrease that pain. The next technique is my favorite, movement or gentle exercise. Why does this work? Well, for one, it will release endorphins. So you've heard of the runner's high before. What those endorphins do is they give your body a little boost and you feel good for a while, and the effects can last for a few more hours. It also improves circulation, which is really important because we live in a culture of sitting, which decreases the circulation and things get stagnant in our bodies. And the last thing is it reduces the stiffness. So again, if you've been sitting, if you've been standing for a long period of time, even if you've been walking, you think, I'm moving, I'm stretching every muscle in my body, but it's not true because your muscles are only going through a limited range of motion. So things that I want you to start doing: walking, stretching, gentle yoga, aquatic therapy. Again, getting in the water is some of the best pain relief that we can get. And of course, keep this on your tolerance to your condition. So don't push too hard, too fast, because it can set you back. Make sure that you take everything nice and slow. Another technique that you can do is positive self-talk or reframing. A lot of times when we have pain, all those negative emotional conversations come into our head and we just think, why is this hurting so badly? And it actually can make that pain level worse. So instead, if you think with a positive mindset, okay, if I keep moving, the pain will go away, and then do that, move around, and you should notice that that pain should decrease a little bit. You can say, I'm safe, my body is healing, this is just part of the process. That will help to decrease any anxiety and again, decrease some of that pain. I mean, you've had bad episodes or bad things happen to you. You can get through this. If you just remind yourself of that and think positive, speak positive to yourself, you'll be amazed at how much you can control that pain level so that it doesn't escalate and that anxiety does not go with it. So the last technique that you can use is ice or heat. These modalities alter the nerve signal transmission and they reduce inflammation, and they can also help with muscle tension. So ice you'll use for more acute injuries that will help to prevent the swelling and the inflammation. Some of the physiological effects that ice can provide are vasoconstriction, and this is when it narrows the blood vessels and it reduces the local blood flow. This in turn will limit the swelling and inflammation, which decreases pressure on the nociceptors or the pain receptors. The second thing that ice does is it actually slows your nerve conduction velocity. So this will delay or dull the perception of pain in the brain. Also, cold stimulates large diameter A-beta fibers. These are your touch and your pressure fibers, which close the gate to pain signals transmitted by smaller A-delta and C fibers. So what does this mean? It means that these sensations compete with the pain signals to reduce their transmission to the spinal cord and the brain. So with touch and pressure, a lot of times if you stub your toe, you want to start touching it. That will help to override those pain signals going to the brain. The last thing is reduced muscle spasms. So it decreases the gamma motor neuron activity and erases pain from the muscle guarding or spasm. And this is common after acute injury. So you can use that cold to help decrease the spasms that you get. Heat, on the other hand, has different physiological effects, and most often we use this for chronic pain, pain that you've had for a long time, maybe stiffness because you sit all day at work. So this does the opposite of what ice will do, and it will cause vasodilation. And this means that it expands the blood vessels and it increases the circulation into that area. It promotes oxygen and nutrients that come into the muscles or whatever tissue is injured, and it will flush out the inflammatory metabolites and facilitates the tissue healing. Heat also increases the elasticity of connective tissue or your muscles. So what does this mean? That when you put the heat on it, that these tissues, they start to extend a little bit more, and it requires those higher temperatures in order to do that. This will reduce your stiffness, it will improve your range of motion, and help you feel better in a lot of chronic pain conditions. Heat will also affect what we call the gate control theory. Similar to ice, it will stimulate the A-beta fibers via warmth and pressure. What this does is it diminishes the sensation of deeper pain by overriding those pain signals from the nociceptors or your pain receptors going up to the brain. Heat will also help with muscle relaxation, and we all know this because if we have a stiff, sore body, we like to put heat on it and we tend to move a lot better. So this will decrease the alpha motor neuron excitability, and it will allow those muscles to just relax. Heat will also increase the pain threshold. So again, just like ice, it will override those pain signals going to the brain. You will perceive that that pain level will go down. This makes pain less noticeable during movement or therapeutic activity. All right, so those are our 6 techniques in order to help you decrease your pain level. Again, especially if you're having chronic pain, I know that it will wear on you and it will create more anxiety. So if we can decrease that anxiety and get your body to relax and calm down, that should help out your pain levels immensely. If you've enjoyed these 6 techniques, be sure to subscribe to the channel below. And just remember, better mobility equals a better life.